Health Focus, hosted by Rosemary Mirembe. Join in and learn more from experts who will shed light in different aspects of living your best life as we heal ourselves and each other through connected conversations.
Yes!
Every Monday at 8:30 p.m. to 9 p.m. and repeats on Wednesdays from 9:30 p.m. to 10 p.m. on TBC International 95.3 FM. Better health for a better life and a better future.
Hello and welcome to the Health Focus. I am Rosemary Mirembe. Today, we get to know the role played by the Project Clear organization in increasing access to improved sanitation in Tanzania in just 5 years. Project Clear, an impact-driven business that combines data, behavioral science, and partnership to deliver national development goals. Today, they announce the successful conclusion of its support to the government's Nyumba, Choo, which has increased access to improved sanitation from 42% to 70% in under 5 years. It is through the unique execution of Nyumba, Choo, which combined on-the-ground learnings, appropriate data, and academic theory, which has drove both widespread changes in perception and resulting action. Since 2017, improved sanitation access grew from 42% to 70% of households by 2021, and open defecation reduced from 7.2% to 1.3% over the same period. This is equivalent to improving sanitation for more than 16 million people across the country. However, the impact of the campaign's approach is significant, whereby globally, the unsafe water, sanitation, and hygiene results in the death of more than 700 children under 5 years each day. The improving sanitation conditions have not only reduced the spread of illness such as diarrhea, but also unlocked economic value. Now, let's meet a Tanzanian managing director and entrepreneur of Project Clear.
My name is Kaposo Boniface Mambuli. I was the team leader of Nyumba Choo campaign, and I am the managing director for Project Clear. Project Clear is a consortium or a network of multidisciplinary partners working together to deliver the results for any development agenda. So mainly we do networking of different capacities and professionals.
Well, apart from Project Clear's partnership right here in Tanzania, which other country or development agents or corporates do you have partnership with?
We have worked with Macan Global, which is a creative agency based in New York. We have worked with the London School of Hygiene and Tropical Medicine. These are the gurus of behavioral change and hygiene based in London. We have worked with GWS, who are also working on pharmaceuticals in communication, based in New Jersey. We have worked with Geopo, which is also based in the US, but here in Africa, the headquarters is in Kenya. We have worked with Ipsos, who are also leading in research together with Geopo. We have worked with EXP, which is an experiential marketing firm. We have worked with local entities like Crowds, We have worked with TBC. We have worked with, I can say, the whole array of media in the country, and many others.
I'm curious, how did the Project Clear get to be part of the Tanzanian's national sanitation program?
It's important maybe to note that the government asked the UK government to support them in the development, in the design and delivery of the sanitation hygiene campaign. The UK government tendered the work. We applied for it and won the consultancy. So we were hired as a behavior change service provider on behalf of FCDO to deliver or to support the government of Tanzania deliver its results. So it wasn't us who were delivering, it was the government of Tanzania trying to achieve its sanitation hygiene goals. For us, we are there to support them to get the results they got.
What were the successes that you got after signing off this partnership as Project Clear, and did you achieve your target?
We helped the government to move the coverage from 42% to 72%, and reduce the number or the percentage of people without any sanitation facility from 7% to 1%. Now, it means people who don't have any form of latrine or sanitation, now it has been reduced to 1%. That's not a mean achievement. For us, our goal was to help the government realize its goal. That was the major goal we had. And in due course, yes, we did so without repressing or weakening the government capacity and structures. So we worked with the government structure from the top to the ground with a very small team. So the way we designed this, it was mainly to help the government do its work. But if you ask today, everyone is talking about Nyumba Choo. Government officials in each and every LGAs, especially health officers, they know about Nyumba Choo. They are even continuing doing what was practiced during our time. You may need to know now the government is implementing the sanitation hygiene project through the World Bank funding in 17 regions. The same approach is being used, and very big results are coming out. Because now we have got a huge team down there, a huge army of health officers, government officials, delivering a wonderful piece of work, especially when it comes to sanitation and hygiene.
Firstly, I would like to commend you for the job well done. So, what unique methods were implemented to bring along reaching the target of 72% of increased improved sanitation in the country?
The biggest thing which I can say it really drove the results is recognition. If you, in the past, usually the health officers were remembered only when there is a cholera outbreak, is when they say, where is the health officers? With this campaign, the health officers were called to work before an outbreak. And they were recognized for their great job they were doing, starting with their leaders, the ministers, regional commissioners, district commissioners. They were there working with their health officers, shoulder by shoulder, encouraging them. That is a piece of motivation which they haven't had for a long period of time. Usually, most projects which work in small villages, they go with a big syllabus of trainings. And when you are being trained, what does it mean? You don't know. So that's the assumption which we took out, that these people who have been trained in colleges, they are good colleges and schools where they have gone through here in Tanzania, and for the government of Tanzania to trust them with this job. We cannot just come today and claim to be expert that we are going to train all of them. All what they need is the empowerment. Give them the platform to showcase what they can do better. Yes, they did it. They show that they can do it, and they have done it. And I'm proud for all the team of health officers, community development officers. I can say the whole team of local government officials who did this. Usually, we use almost all the methods of communication. As you know, we had been on social media, we have been on radio, we have been on TV, we have gone out on the ground. I think you have heard about Impoto most of the times. Yeah? We have involved everyone, leaders, people on the ground, people in the middle, in the local government, in the regional government, they have been there. And the only unique thing which we had to go for, which other projects maybe need to learn from, is getting the alignment of leadership. Leadership was in the forefront in this project. You can remember the fundraising of the parliament, women parliamentarians trying to fundraise to construct toilets for girls. I think that showed by implication that the issue of toilets is of a paramount need. And then each and everyone going down the leadership structure got aligned. Because from the top, everyone understood, was aligned, was in support of the movement. So what we did, it was not a village by village campaign. It was a mass movement of policymakers, parliamentarians, private sector partners. They all go together to create a movement which has transformed the sanitation and hygiene landscape in Tanzania.
Looking at the health perspective, we all know poor sanitation leads to the outbreak of diseases among the people. So how serious was the sanitation situation in the country before the kickoff of the campaign?
I can say it was bad, but the most important aspect was on the quality of toilets. I will not say that the situation was that bad, that we didn't have toilets like it is happening maybe in India or whatever, in other countries. The situation was not that bad with comparing with even neighboring countries. Tanzanians have the behavior of owning the toilet and using it. There was a campaign in the 70s known as Mtu ni Afya. So the behavior is there, but the quality of the toilet wasn't that good. It could be just maybe a hole or no superstructure and the like. Yeah? So the benefits of an improved sanitation could not be realized because of that quality. That's why we could hear about outbreaks of cholera. I don't want to attribute the story of cholera outbreaks that we haven't heard for some time now to myself alone, but the credit is to the government. Because since, maybe I can say for a period of time, it may not be only this work, maybe other work, but if I want to show you what is the achievement, how bad the situation was, it's like I'll go back to the time when we could talk about cholera outbreaks. Now we are no more talking about cholera outbreaks. God forbid, I don't want cholera outbreak tomorrow, just to prove me wrong. But the whole point is that this is like congratulations to the Ministry of Health and the whole cadre involved in the sanitation and hygiene subsector.
Has the improvement of sanitation unlocked the economic sector in Tanzania? And do you think it was affected?
For me, I can say it has unlocked on a bigger scale because first and foremost, morbidity is the enemy of productivity. If you fall sick today, it means you're not going to work. Do some productive work which is going to bring you some income. Leave alone on an individual basis, on a household, the money they spend in treating preventable diseases caused by sanitation and hygiene. You don't talk about the Ministry of Health, the hours doctors are spending treating these diseases, the medications. Now, all those resources have been pushed out into more productive sectors like infrastructure. You can see now there's a lot of construction of new hospitals, new bridges, flyovers. Now we're transformed. And I'm proud to say during the time when we were there, we even pronounced at one point that we are leaving the low income to somewhere mid-income. For me, that shows the good work. People are focused, trying to do productive work in development, and resources being redeployed into other sectors where they could have more returns on the development work of the country.
This country has got very many cultures and beliefs. While launching the campaign of Nyumba Choo in rural areas, how did you deal with the negative responses and attacks from some of the people?
Actually, the only problem we get usually is that people go and develop and design campaigns based on different positioning. These people, they go in to develop what I call educational materials. In that way, they assume that people are not owning or building toilets because they are ignorant, which is not true. People, it's not that they are ignorant, that you need to go and train them how to build toilets while they have got beautiful houses. It's not true. Now, with our research in the design, we went further. We didn't look at the problem is that people don't have toilets. Now, we went deep to find the root cause. Why are the people not owning or building toilets the way they are owning and building beautiful houses? Is that they never believed that a toilet is part of modernity. Or what we had to do, not to go and tell people build toilets. Then we'd just be patronizing them. But we showed them how a toilet is integral, is one of the critical pieces in one's advancement, in one's development. So if you say, I'm modern, I'm developed, which each and every person aspires for, if you take away the toilet, you don't feel you're complete. And that is the message which we gave people, and people realized, yes. And accepted it. So it is true, we are taking it for granted. Hence, nyumba ni choo, usichukulie poa. Don't take it for granted. Yeah? Development is not complete without a toilet. Yeah? So that message resonated with Tanzanians. And they went out to respond and build toilets. But all these past years, people have been told that they are ignorant. They don't know how to build toilets, which really didn't resonate with why they didn't have toilets. So if you get a right insight, it doesn't matter. You have got a different language, a different culture, but it cut across. Each and every Tanzanian today is aspiring to be modern, isn't it? So if we attach our campaign to that insight, then it doesn't matter which culture, it doesn't matter which language, which age group. So we all spoke the same language and easily. Hence, the success.
Hence the successful education campaigns in most rural areas. Now here sits villages who have no capital or ability to construct a toilet for their home. Hence open defecation. So how were you supporting them to make sure they also have toilets in their homes?
Thank you very much. That's a very smart question. I know even poor people, they are aspirational. I hope you know that. Sometimes when I started working in this sanitation sector, long time in 2006, I was a national coordinator for hand washing with the World Bank. We were reached by people who said, no, for poor people, you need to use ash for hand washing. But that was not aspirational. It's like you are relegating the poor people. Stay there in poverty. Don't aspire to come out. You hear me? So we didn't really give any money to any poor person. We recognize programs which are out there, which identify poor people. Like TASAF, they're there. We might not have been the best people to know who deserves to be supported, and the communities themselves. Because if we used to say modernity, your village is modern. People want to be affiliated to their modern villages. They will help neighbors to construct it. Because now it's a theme. We all want to be modern. Now I can't be modern and my neighbor is defecating in the open. It means the whole village is backward. So through that kind of communication, villagers have got their own systems, how they help each other. And that is what helped us. Actually, we just pushed that concept of modernity at an individual level, at a community level, at a regional level, at a district level, and at a national level. If you could look, there is this cleanliness competition, maybe you have heard about it, where regions compete, cities compete. Yeah? Yes. It's the same concept. Yeah? Now, there's no region which will need to be seen that they have failed. So they will be there to help each other. The community will be also there to help them, each other, so that they can compete favorably. And lucky enough, the government has been rewarding all those. You've heard about Nyumba winning. You've heard about Kilimanjaro winning. Yeah? It creates that aspect of aspiration. It doesn't mean that in those regions there are no poor people. They are. But what do? You are strengthening the systems which exist within there. How do these support systems work? And then we learn from those systems and try and share the same ideas with other regions. Because if you go parachute into a village with your own way, it means you are going to weaken the existing system. The moment the project is done, you are out, those people are back. Now you are pushed them back into dependency. But the systems which have been there, we have strengthened them, and they are working wonderfully. All these numbers we are talking about, we didn't really bring any money to any village. The village, the households invested heavily to modernize themselves because a toilet was modern. After saying that, there were some other options because we are not telling people, go build a modern toilet. No. Build an improved toilet, that's why we wanted a toilet and a house to be relating. You cannot have an iron-roofed toilet and then you have got a grass-thatched house. That's why our comparison was Nyumba, Choo. Your house should match your toilet. Simple. Yeah? And then, after saying that, we brought in some of our partners like Rexon. After working in sanitation and hygiene for a long period of time, yes, the aspect of cost is there. Even in town here, we can talk the same. There are people who own bicycles. There are people who own motorbikes. There are people who own cars. There are people who, even cars, they are different. They are Vogue, Mercedes. Yeah? It depends on your ability.
As one of the retiring partners of the Nyumba Choo project, after this experience, what is your recommendation to the Tanzanians and the government?
Maybe I can say not to the Tanzanian per se, but looking at the government, looking at the experience, the journey we have taken, we think other sectors apart from health, they can also borrow a leaf from the Ministry of Health and learn from what they have done, see how they can also benefit from the same approach which we have used to help the Ministry of Health or the health sector. There is agriculture sector, there is energy sector. You're talking about unclean energy, charcoal. Now, how can we help people start enjoying better service by using this kind of approach, by engaging with them, by listening to them, understanding the real root causes of their issues, other than imposing what we think is good to them. And again, we're also trying to appeal to the development community. There are other organizations which also want to achieve results, because all these development partners are trying to help the government of Tanzania achieve the results. If they want to achieve results with less cost and within a short period of time, and really transforming people, is using this approach. Because any development starts with the mindset. So if you transform people's mindset, people's attitude, you're almost there. So with this approach, where we only worked on the frontline workers' mindset, we worked on the general public mindset, then everyone was aligned. We got the results. So we would have urged them to try to employ some of these tactics.
Well, TBC International listener, that was a Tanzanian entrepreneur, Kaposo Mwambuli, the managing director of Project Clear, which is an impact-driven business that combines data, behavioral science, and partnership in order to deliver national development goals. Today, they were announcing the successful conclusion of its support to the government's Nyumba Choo. after increasing and improving sanitation from 42% to 70% in under 5 years. My name is Rosemary Mirembe. Goodbye for now.